Hello, my name is Augie Wellborn, and this is my our continuation of my videos on kidney stones, kidney infections, urinary tract infections, and basically what you can expect and what we go through. Right up front, I'm not a doctor, so anything I say here is not meant to be medical advice. It's just my opinion and should be taken as such. Everything I say here is based on my personal experiences with kidney stones, infections, urologists, hospitals, ER doctors, nurses, EMTs, insurance companies for the past 40 some odd years. I'm hoping in these videos that you will find some information that might help you. Also might just make you feel better knowing you're not alone, that other people are going through this. Trying to keep this under 10 minutes, so this first pass is going to be kind of like a recap. First of all, kidney stones are hardened minerals deposits that form in the kidneys. They originate as microscopic particles and develop into stones over time. The medical term for this is nephrolithiasis. Probably mispronounced that, but I'm sorry. The other name is renal stone disease. There are 5 types of stones: bladder stones, calcium oxalate stones, which are the most common, uric acid stones, and the rare cystine stones. Yours truly gets them all. For those of you that aren't really sure what the kidney function is in the body, the kidneys filter waste products from your blood. They add them to the urine that they produce. When the waste materials in the urine do not dissolve completely, crystals and kidney stones are likely to form. And the longer they sit in the kidney, the larger they grow. Some good indications that you have an infection or a kidney stone: cloudy urine, blood in your urine, increased frequency in urination, or at least feeling like you have to go to the bathroom, but you really don't. You go and you only trickle a little bit, and it hurts like hell. That being said, pure pain during urination and burning and stinging. Tenderness in the abdomen, kidney region, radiating into the groin area, lower back, mid back. Feels like someone stabbed you with a knife. Fever, chills, vomiting, loss of appetite. Now, if you're passing a stone, that can be anywhere from you don't feel it at all and it just all of a sudden happens, to being uncomfortable, a soreness, to being downright painful. But the truly unique pain of kidney stones, the one that gets remarked on, as being the worst pain, or the closest a man can come to knowing what childbirth's like, more on that later, is when a stone actually is not passing. It's stopped, it's clogged, it's blocking your ureter or urethra or somewhere thereof, and the urine is backing up. It makes the kidney swell. The kidney just is not designed to do that, at least not much. It hits the nerve endings, and that's where the pain goes from. They ask you a lot of times, rate your pain from 1 to 10. There's not a number high enough. Okay. That's when you have that pain where you're laying on the floor, and you're in a fetal position and you can't move, or you're on your back and your knees are drawn up over your head, and you're always rocking back and forth because you really don't know what to do. But that's when the pain is really bad, is when the stone actually stops moving and blocks everything. Just on that note, if you're having the passing pain, in other words, uncomfortable, you kind of feel it, you realize it's gone from your back to your front, and which is moving. A couple of things you can do that I found helpful, that were recommended to me too by some very good urologists and some very good friends who have the same problem. Believe it or not, jumping up and down. Obviously drinking a lot of water, but actually jumping up and down. The act of that shock, it tends to make the stone move a little bit. Also, if you're in that back pain area and you want to relieve that back pain, if you've got a hot tub outside, jump in that hot tub. Get it as hot as you can stand it and get in it. Just short of that, draw a hot bath, jump in that hot bath, and that back pain is going to go right away. I kid you not. As soon as the water cools down, your pain's going to come right back, or as soon as you get up, a few minutes later, the pain's right back. But while you're in the water and it's hot, it relaxes everything and it helps the stone pass, or it just relieves the tension of the pain. Gotten pickled that way many times sitting in the bathtub. Okay, well, next thing we're going to talk about is your first visit and when you should go to the hospital. I just wanted to make this one as short as possible, just a recap. Okay, next, stay tuned for the hospital visit. Thanks very much.